Welcome to today's webinar entitled Inside and Out, Extending Hospitals' Healthy Food Environment Work into Communities. This is the last webinar in a four-part series that we have been doing, sponsored by the American Heart Association and Public Health Law Center, which is focused on creating healthier food and beverage environments in hospitals and healthcare settings with a particular focus on reducing sugary drinks. My name is Craig Massetti. I'm a policy analyst at the Public Health Law Center and have been helping to lead our healthy healthcare work over the past couple of years. Next slide. The Public Health Law Center is located in St. Paul, Minnesota at the Mitchell-Hamlin School of Law, which is located on the lands of the Dakota people. We're a team of attorneys and policy analysts that support communities nationwide in improving health by advancing laws and policies that are centered in community needs and grounded in public health evidence and solid legal principles, with a particular focus on preventing and reducing chronic diseases and promoting health equity. At the center, we believe everyone deserves to be healthy, and we're committed to partnering with communities and organizations to advance laws and policies that go beyond just equitable access to supporting equitable outcomes. And this means addressing the social determinants of health, meeting the specific needs of all communities, especially those who unfairly bear a greater burden of health challenges and societal harms. And this is really why we've been working with the American Cancer Society and other groups across the country to address sugary drinks. As many of us know, sugary drinks arguably have no nutritional value, yet they are disproportionately consumed by and marketed towards Black, Indigenous, and people of color, who at the same time experience associated health consequences like type 2 diabetes, heart disease, and other chronic conditions. Next slide. So, as I said, over the past couple of years, there's really been an increasing number of hospitals and health systems across the country that have stopped selling sugary drinks or reduced their availability in favor of healthier alternatives. And groups like the American Heart Association, American Academy of Pediatrics, American Medical Association, and others have really joined in this movement and urged hospitals and health systems to improve and create healthier food and beverage environments. And our work with ACS has tried to support this movement. And so earlier this year, we released an updated version of our Healthy Healthcare Toolkit, which you can access at the link on this slide, which is a suite of educational and technical tools that help healthcare organizations, really any employer, develop and implement a healthy beverage policy or initiative. Next slide. And as I said, you can find the full suite of resources as well as some state-specific tailored resources at our website, publichealthlawcenter.org. We have also been hosting a series of webinars, as I mentioned, which has really been focused on highlighting innovative approaches and success stories and key lessons learned. The three webinars are shown on the slide here, modeling health, talking about why health systems should really take on this issue, as well as several other webinars that have looked at particularly examples of innovative approaches and how to really leverage data to make the case. And again, you can find recordings and more information about these on our website. For today's webinar, it's really about recognizing hospitals and health systems as unique anchor institution in community and thinking about the unique role that hospitals and health systems play in community. And so we'll be talking about not just what food and beverage environment improvements look like within the four walls of a health system or a hospital, but really how those actions relate to things happening in the broader community and the bidirectional relationship of how that influence can happen. And so we'll hear things like how one hospital's action may nudge another to do the same, or a health system translates its own experience into helping other major employers, or a health system advocating for community health improvement through policy engagement. And so for today's webinar, our two speakers will be sharing experiences from two major health systems in Minnesota. And I'd like to welcome Susan Marschke, who is manager of ambulatory nutrition services from Park Nicollet and Health Partners, as well as Jody Gherkin, who is a community wellness program director for Centricare. I will just briefly introduce both of our speakers who will present for about 15 minutes or so, and then we'll use the rest of our time together to really engage with your questions and comments. So Susan will start us off, and she is a registered and licensed dietitian. Her clinic practice specializes in weight management and bariatric surgery. She's practiced at Park Nicollet for over 28 years, and she manages a team of over 15 dietitians and other staff, and she has a strong passion in health and wellness, particularly with achieving those through nutrition. And this passion really comes to light in her work through the Better Eating Collaborative, which is a group at Park Nicollet, and she'll talk more about that, as well as her development of patient education materials and continuing education efforts. After her, we'll hear from Jody Gherkin, who has 23 years of experience in public health, 15 or so of which have been in various roles with Centricare, managing and leading community health improvement projects and initiatives. She started at Centricare in 2004 as coordinator for Crave the Change, a community coalition working to reduce exposure of secondhand smoke. Her work then later focused on childhood obesity prevention efforts, and most recently, as of 2015, she has been overseeing the umbrella community health initiative at Centricare called Feeling Good Minnesota, which is focused on creating and supporting healthy communities. She also sits on various other committees and boards, including the American Heart Association Statewide Advocacy Board and the Minnesota Healthy Kids Coalition Steering Committee. So again, thank you both for joining us today. Really looking forward to learning from your experiences and expertise. And with that, I will turn it over to Susan.
Thanks, Craig. It's a pleasure to be here to share our story today about the work we did to reduce access to sugar-sweetened beverages. Next slide. Health Partners is now an integrated system that includes a care system and a health plan. However, when our work began, we were not yet combined. And what I'll highlight today is the work that we did at Park Nicollet, which include a large hospital and about 20 clinics out in the metro area of the Twin Cities. Our vision started in 2012 with 4 very passionate physicians who came from a broad range of practice areas. They saw a benefit in maximizing nutrition, which of course is a passion of mine as a dietitian, and really saw food as medicine. With their leadership, we developed a steering committee that included nutrition leadership, and from that steering committee, we created the Better Eating Collaborative, which was really a groundswell of interest from people throughout the organization and the community that were interested in learning about and implementing ways that we could provide a better food environment in our locations. Next slide. What we were able to achieve was at Park Nicollet 100% sugar-sweetened beverage-free environment by 2016. That was available at Methodist, our hospital, and also all of those clinic locations. By that time in 2016, we were a combined organization with health partners, and our health partners colleagues were able to achieve an 80% sugar-sweetened beverage-free environment and also had a few pockets of locations that were 100% sweetened beverage free. One was a hospital in western Wisconsin, and all of the retail pharmacy locations had removed those sugar sweetened beverages, which was really great work and wonderful for that client or consumer facing aspect. We were also at that point working with our plan members and our well-being participants and clients on ways that they could implement this work, and working at the community level with Hennepin County on a CHIP initiative. Next slide. We worked for over 2 years to obtain the buy-in from all of these groups, and I'll highlight each of those now. Next slide. With leadership, we met with the CEO and senior leaders, and specifically the hospital leadership. We met with our pharmacy colleagues who had experience in removing those sugar-sweetened beverages and learned a little bit about the logistics that they found helpful to know as we looked at ways that we could make change. They made suggestions about different drink options that they were offering, some ideas about how we might use coolers differently, or even some spots where they were removing coolers so that beverages weren't as visible. We ran into some challenges with the leaders in expressing why this was an important topic for the organization to focus on. And to overcome that resistance, we really worked on tying our mission and vision and the triple aim and talking about how this was just the right thing to do to develop this environment. We also showed them that we were not alone. There were many other healthcare organizations that were making this change. Next slide. We took our show on the road. We got out to all of those different clinic locations and we talked to the individuals and the clinicians that were working in those environments. We tailored our messages and the speaker to the audience so that we could be 100% transparent and open to feedback and conversation. And there was a lot of conversation. We wanted to make sure that people were heard and understood. We also use this as an opportunity to educate. Although we work in a healthcare environment, we know a lot of our colleagues don't come from a healthcare background. So we wanted to make sure that they knew about the evidence-based research that showed the impact of sugar-sweetened beverages on many chronic diseases. And we also talked about how we would continue to offer non-nutritive or artificially sweetened or diet beverages because there wasn't conclusive evidence that those were going to be problematic. And I think that was an important point for a lot of people because they took this message to be, they're taking away all of our soda, they're taking away all of this, everything that we like to drink. And by highlighting that there would still be many options that people were accustomed to buying, it was an easier message to present. And we also knew that Diet Coke was the top seller. One of the challenges that we did meet, though, as we worked with these smaller groups was for inpatients, for those hospitalized patients that do have a higher need for calories or maybe need some carbohydrate, particularly people who might be nauseated or managing blood sugar variations. So we taught the staff in the hospital to first of all offer alternative beverages, things like 100% fruit juice or an artificially sweetened ginger ale. But ultimately, we decided and agreed that sugar-sweetened beverages could be offered to hospitalized patients with a physician or a clinician order to provide those. Again, as we worked with our colleagues out in the different clinic locations and hospital floors and wards, we emphasized personal choice as well, that if people wanted to consume sugar sweetened beverages that they brought from home, that they could certainly do that. And again, that was a big point of relief for some people, that it wasn't a big brother kind of setting where we were watching and not allowing people to bring those and bring their own beverages from home. We emphasized that we were removing sugar sweetened beverages from distribution and from sale. Next slide. Food service, of course, is a significant group to work with, and we worked with them from the get-go. They were part of the steering committee and involved in many of the meetings and discussions, and those of us on the steering committee were going to some of the meetings with the vendors as well to help understand what kinds of challenges were coming up. It's interesting to note that the food service at the Park Nicollet locations and Methodist Hospital is an internal food service. We don't use an outside vendor. And the food service at the hospital also manages all of the vending contracts. And that was definitely a challenging part of this implementation. There was an expectation that revenues would decrease, and of course, concern that went along with that. So we were able to obtain permission to have that loss of revenue happen. And we also implemented some strategies to help offset that. We increased the number of acceptable beverages. In some cases, we gave preferential pricing to those acceptable beverages as an incentive. We ran a lot of taste testing areas. And if you think back 4 years ago to 2016 when we implemented this, there weren't nearly the number of non-sugar sweetened or non-artificially sweetened beverages. There were just a handful of things. That market has really boomed in the last few years, which makes it much easier to implement these and offer a broad range of interesting products. But we still managed. Next slide. We also announced this. We used a press release and a Q&A sheet that was widely distributed to publicize the work that we had done, and again, pull in our community and use this as a feather in our cap of something that we were doing to take care of ourselves and our community and our members. Next slide. One of the keys to our success came from the CEO announcement. That was a great way to get the information out. We also worked with our marketing and communications partners. We had clinician champions, as I talked about them earlier, going out and doing some of the discussions and the talks. Our champions were also good at continuing to integrate this message into their communications with their colleagues and with their patients, so that consistent message was heard again and again. We developed a lot of educational material that then became things that could be used out in our worksite health promotion areas as well. We did a lot of information on making your own beverages, some alternatives that people could use with flavoring waters. Again, that's not such a novel idea anymore to infuse fruit into water, but 4 years ago, there weren't many people doing it other than kind of a slice of lemon in your water glass. So we really promoted those and promoted some interesting combinations of things. We continued to have presentations, conversations, email inbox where people could send their feedback and ask their questions. We were very transparent about what we were doing and making sure that people had an opportunity to be heard and to get clarification. Next slide. Here are some of the tailored communications and promotions that we used, both internally and with the work that was done in our health and well-being clientele areas. Next slide. Specifically for those health and well-being clients, we can help to connect the replies to the health assessment data and the biometrics with chronic condition data. We can share self-reported consumption data for those clients to get a better grasp of what's actually happening with their populations. We work with these clients to know their culture of the organization, as we know that's a large factor in how well incorporating a sugar-sweetened beverage-free environment might be accepted or incorporated. We've found success with the Health Partners program manager being on site to help steer some of those conversations and be part of the discussions as that partnership with food and beverage vendors is developed and nurtured, and also with food service programs. Here's a picture, next slide, of some examples of that work in action. You can see some interactive displays on these tables, some promotional items and graphics. Next slide. And then here's some pictures of the actual vending options that were available from vending machines. You can see the Yum Power or the Be Well logos around some of the preferred products and the wraps on those vending machines. So thanks for your attention this morning. We'll wait and take questions after Jody's presentation.
Thank you so much, Susan. That was great. And yep, Jody, over to you now.
Excellent. Can you hear me?
Yep.
Great. I would just like to reiterate, we at CentraCare, and I'll explain that in a little bit more, also kind of looked to the work that Susan and her staff did prior to implementing our internal policy. So our journeys are very, very similar from diet beverages to messaging. So I'm not going to go down that trajectory, but kind of take you on a different path. So rather than thinking about how this work started internally and went externally, our journey is a bit different in that we took that outside in approach. For those not familiar, CentraCare goes back to 1886 when the St. Cloud Hospital, which is the biggest hub in our region, was built to serve the healthcare needs of people living in central Minnesota. In 1995, CentraCare was formed, which today includes 8 hospitals, the one I mentioned in St. Cloud, and then we also have rural hospitals in Long Prairie, Melrose, Monticello, Painesville, Redwood Falls, Sauk Center, and Wilmer. For those not from the state, that would basically be just the belt right across central Minnesota. We also have 30 clinics, 11 senior housing facilities, and 7 long-term care facilities throughout the area. As mentioned in my bio, I started with CentraCare in 2004 on a grant, again, external, internal, from our Minnesota Department of Health to work on smoke-free workplace policies throughout the greater St. Cloud area. Immediately, we began to partner with our local chamber, with businesses and other health advocates for both the state and local policies that were in play. In 2007, after the Minnesota legislature passed our Freedom to Breathe law and became a smoke-free state, I transferred from the Heart and Vascular Center to our foundation, which is the philanthropic arm of our association. Again, to apply very similar processes in infrastructure and community work to reduce body mass index amongst adolescents by 10% by 2016. And there was no rhyme or reason to how that was chosen. I think some really good intended people said, that sounds like a good idea. So we went ahead and started using our electronic medical records to track body mass index amongst adolescents in the area in which we were going to be implementing some changes. So over 8 years, we saw a 24% decrease in 12-year-old body mass index in the zip codes where we were applying numerous system and policy changes. And those included, and again, we comparatively looked at this data against other zip codes we weren't so actively engaged in. And the unique thing about CentraCare versus some of the health systems in the Twin Cities area is that we're really the only health system. So it's very likely that our electronic medical data reflects what really is happening in terms of health in our communities. So what we did was, again, and I refer to Susan saying, you know, back in the day, this was pretty innovative stuff. Now it might not be so much so, but we implemented healthy checkout lanes in our grocery store so that people were coming through and they had healthy options immediately available rather than less healthy for you choices. We made several safe routes to school initiatives with local municipalities and school districts. We passed complete streets policies, we passed sidewalks ordinances, And we even launched a very innovative new Val food scoring system with our local grocer throughout the state of Minnesota. But unfortunately, that LCC doesn't exist anymore. But it was a great partnership. We worked with Blue Cross Blue Shield of Minnesota, CentraCare, and a grocer. It was like the butcher, the baker, and the candlestick maker, these three entities coming together and trying to be really collaborative in how we were addressing obesity in our communities. So we weren't just simply making changes, we were really trying to change the entire landscape. So obviously our success reflected the relationships that we developed and the collaboration amongst our partners. So when we began working on healthy eating and active policy guides, which I'll mention momentarily, it was really an aha moment for us to say, wow, we're asking everyone else to clean up their backyard. Perhaps we should do that in our own house first. So we began looking at, what are some of the ways that in which we don't want to ask others what we're not willing to do ourselves. So in 2018, we passed a healthy food and beverage policy, which makes all of our CentraCare locations 100% sugar-free for our beverages, sold both in our cafeteria and in our vending machines. And then we have a 50% healthier for you food options, which we're continuing to work on to increase that in all vending, all dining options to 75%, while we're also looking at decreasing portion size. So one example where we've done this already was in our policy for accepting funding, donations, or sponsorship. And this was one of the first initiatives we worked with the Public Health Law Center on. And again, I can provide all of these PDFs or links after the seminar. But what we did, what we noticed when our initiatives were being so successful is that we were giving an opportunity to partner with many different organizations. People really wanted to be a part of this initiative. So our local McDonald's food chain came to one of our development officers and said, we'd like to support the work that they're doing to reduce childhood obesity prevention. And of course, money speaks, and everybody thought, well, that would be a brilliant idea. And I said, we wouldn't run a cessation program with money from Philip Morris. This is kind of the same thing. We're jumping into bed with the wrong group. So to make that more solidified, we worked with the attorneys from the Public Health Law Center on this document, again, which I apologize you can't see, but we set criteria to say, do we have more to gain or lose from partnering with such an organization? And it wasn't that we had to go through all 8 of these and say, yep, yep, yep. But it gave us an opportunity and a platform to start asking some deeper questions. What do we gain? What do they gain? What could we lose? What happens to our brand integrity? So that's been really instrumental, not only in how we would accept funding and support during our work to reduce childhood obesity, but we've used it now even in COVID, where we've had some incidents where people have wanted to provide money to do relief, and it really was not an authentic fit. And so we referred back to this and said, if we were thinking about this in this space. So I challenge many of you, if you're going to be doing this kind of work, that this is a great thing to set up in the front end so that you don't have to kind of retro back and think maybe that wasn't such a great idea. Next slide. So we began our work again as we were now kind of our backyard was a little bit cleaner, decided we wanted to help our communities in doing the same thing so that our patients who are our communities would be both supported while they're in our hospitals and clinic settings, but likewise when they're living and making those choices that impact their health every day. So we created the Healthy Eating Policy Guide. What we wanted to do with this guide was really say, here are the best practices and options that are happening across the state of Minnesota. And in doing so, we were able to work again with those attorneys who could do that research for us and put together a guide that felt we were really using best practice for our region and for our state. And we could learn from others. And again, providing evidence-based, science-based opportunities for businesses and communities around healthy eating. So we did a similar one. We want to go to the active living. So we likewise thought, okay, here's another opportunity for us to branch out into our communities, work with municipalities, local boards at the county level, and again with individual businesses that were interested in this work. This resource guide is designed for local government, again, policymakers, local public health advocates, and active transportation advocates. It describes a variety of policy options available to local governments to facilitate walking and biking, and it also provides examples of showing how these policies have been used in Minnesota. The first part summarizes the power and limitations of different types of local governments and the role of policy in active transportation. We had one of our doctors testify at a city council meeting for a sidewalk ordinance. And when he was done, he was like, I never thought sidewalk could be so contentious. And it was like, yeah, it is. One side wants it and the other side doesn't want to shovel. In Minnesota, as you know, we get quite a bit of snow. So, but we knew that if we had those built environments, we'd be creating opportunity for people to impact their health, every single day, that they didn't have to have a gym membership or be doing something very rigorous. It could be part of just your daily life. So the publication was prepared again by the Public Health Law Center at William Mitchell. We also worked with our League of Minnesota Cities, our Department of Health. So we're very proud of these policy guides in terms of how they've been put together, but how they've also been reviewed. And they've been very well received by our partners because we've done the homework for them to make it as easy as possible to implement some of these changes. So ironically, it all goes back to the triple aim, as Susan mentioned in her presentation. We have the quadruple aim. Our CEO really believes that it's not just about improving patient experience, reducing cost, and improving population health, but how are we also engaging and keeping our own employees safe, our people. We have about 15,000 employees throughout the central Minnesota region, and we know by doing this work, complementary again, both internally at the workplace and externally in our communities, we're really supporting health where health happens. So we'll be continuing to do this hard work. We do it both at the local level and the state level, and then again, working with some of our new clinics and hospitals that we're acquiring throughout the region. That's it.
Great. Thank you so much, Jody and Susan, both for your presentations. I think a lot of really helpful points, both in terms of challenges as well as successes and things to think about. For participants, we'll open up the Q&A at this point. And so if you do have questions, please use the Q&A function that's down at the bottom of the Zoom toolbar. Perhaps to get us started though, I think both of you touched on in different ways the importance of messaging with various stakeholders and creating buy-in in different ways. And Susan, I know you had used the phrase kind of doing the right thing. And then also, of course, the challenges of navigating the individual choice argument, so to speak. And so, so I'm wondering if maybe you could talk a little bit more about what some of those key messages were, and then also, again, I think the unique role of clinicians and providers as well. I think, Jody, you had mentioned the sidewalk example, and then Susan as well, kind of talking about the unique and impactful voice and perspective of clinicians and providers. So we'd love for both of you to kind of expand on that.
Sure. Well, again, it's stepping back 4 years, and it was really novel at that point for our physicians to bring forward research that pertained to using sugar-sweetened beverages and cancer risk or heart disease. Everybody agreed on the obesity and diabetes risks and blood sugar regulation, that type of thing, prediabetes, all of those. But some of those other disease states were really novel. And so we distributed links and provided PDFs of the research, provided educational material for our employees that maybe didn't want to dig into that high level of research, but what could we pull out in terms of just quick bites of information. We did it, in those group settings I talked about. We also did just casual conversations that Better Eating Collaborative was essential in disseminating the information because they were embedded in the work site. You know, we weren't challenging people necessarily that we saw with a regular sugar sweetened beverage, but we might make sure that that person had gotten the message. That, you know, there were going to be some changes happening, and did they understand, and that this was about their individual health, not that we were trying to take something away, but that we wanted to make sure that, hey, are you making an informed choice? You know what's going to happen as you do this. I didn't mention, but I think it's very fair, especially with Jody's perspective, that we had another champion who came and did a keynote speech for us, who was one of the physicians that was absolutely instrumental in removing smoking from this whole state of Minnesota, and in particular Methodist Hospital. And he was just inspirational in the way that he approached it. And similar to what I talked about today, he said, you know, when we started this back in 1984, we were asking people as they got to the hospital, do you want a smoking or a non-smoking room? And, you know, the whole room erupts in laughter. And you think back to that and you think, wow, could this be the topic that 20, 40 years from now we're saying, isn't that silly? We were selling all of these just nasty beverages that were making people sick. So it was fun to have that perspective as well.
Yeah, and I would echo that. We had great support from our CEO. Once you could get that click that we are a healthcare system, at that time we were CentraCare Health. We have since dropped that from our name, but you know, to say we have health in our name, we need to lead by example, and we need to support people, you know, while they're in our settings, et cetera. And again, so many of our staff who spend 8, 10, 12-hour shifts there. We did the same approach with not eliminating diet beverages because likewise at the time, the science really wasn't as compelling as the 100% sugary beverages. And then also reiterating, people can bring it in from home. We didn't have any kind of enforcement at the door that was going to tackle you if you brought in a Mountain Dew. Like, you can still do that. You can keep it at your desk or in your cooler. We're just not going to provide it, considering some of the most chronic diseases that we treat can be impacted by the amount of sugar that people have in their diets.
Great, thank you both. There's a quick follow-up that just came in actually in the Q&A about any kind of particular approaches or strategies you used in order to gain buy-in. So the question particularly asked about using things like focus groups. I think, you know, Susan, you had mentioned incorporating things like taste testings related to new or potential products. And so what were some of the specific activities you used, especially with trying to reach all employees in a very large organization?
You know, I don't recall that we did use focus groups. Our Better Eating Collaborative was kind of our focus group. It was a large group of people. I think the distribution list was over 300 people and very representative of areas throughout the hospital and the larger clinics, as well as the pretty small kind of satellite clinics almost. There were people everywhere. We also have a long history of wellness initiatives throughout the organization, and had another team within that group, the Be Well group, that was helping to distribute this information. It's a pretty common practice back then to go out 3 to 4 times a year with these kind of road shows of different pieces of information. And people were often very willing to spend a lunch hour listening to what the group was bringing because it was a way to stay connected to the larger organization. So that was kind of our focus group.
We did a small test of change in a building that had employees only and no direct patient care, patient access, because we thought then we could really try to get a deeper understanding of what our employees were looking for. So we did a pre-survey, and actually, interesting and ironically, we found out when we asked the question, do you use the vending machines? A lot of responses came back saying no, because there's nothing healthy or good for me in either machine. So that became a pivotal aha again moment for us that we could use to support the work that we were doing. Back, pre-COVID, we could do a lot of things differently. So we worked closely. We have both a Pepsi and a Coca-Cola vendor. We do all of our contracting 50-50. So we worked with our vendors, and they brought in and did sampling with various kinds of snacks. They did beverage sampling, different kinds of waters, so that people felt they had some say in what they were choosing was going to be replacing what they presently had in their machines. And that worked really well for us. And then as we began to expand out, we just took our lessons learned and moved forward. We now have a new hospital that will be opening in Redwood Falls in February. And at this point, they've just decided we're going to open entirely sugar beverage free. So we're helping them again with messaging, letting people know what's happening, being very transparent, but not just also dropping the hammer on day one and saying it's all gone. So that's been kind of part of our success.
Great, thank you both. And actually, kind of a follow-up, Jody, to your point of kind of the system expanding and acquiring new hospitals or having a new location. And Susan, you had touched on this point as well a little bit, just with the coming together of Park Nicollet and Health Partners being two different systems, and so I'm curious if both of you have thoughts or challenges where there are these cases where you have systems coming together that may have two different existing policies, and how you mesh those two things together, or in thinking about how to either whether retaining separate policies or trying to kind of fit a new acquisition into an existing policy or something like that. So we'd love to hear a bit more from both of you on some of those challenges.
Well,
Sure.
I think for us, if you look at it from a global perspective, as we acquire new hospitals, some have different unions, some are non-unionized. There's a lot of integration that has to happen. So this almost rises as an easy option compared to some of the more difficult HR things that were happening. But we gave it a sense of pause, let people get acclimated, and then explain why we were doing this. And we always promote that we are one CentraCare. So we want that integrated feel, so that if I am at a hospital in Painesville or a hospital in Wilmer, all of those similarities on how I'm treated as a patient as to what those options are for me in the dining setting. So we gave it a little bit of time, but at the end, it's all kind of thankfully come along really positively.
Great, thanks, Jody. And Susan, any additional thoughts? Uh-oh.
Can you guys hear me?
There we go. Yep.
Okay. Sorry
We
about
lost you
that.
briefly, but
Okay. And I apologize. I had a little bit of technical difficulty, and I'm on a cell phone, which is a little bit different look to Zoom. So here I am. We've had a different experience. We are a very large organization, and as Craig mentioned, the Health Partners side, which is also a clinic group and an insurance company, had hit that 80% sugar sweetened beverage free, but were not able to go to 100%, partly because of some contracts. And as we've acquired and built our business, we are encouraging our new partners to incorporate beverage policies, but aren't finding that it's an area that we can make as an absolute. So we keep working towards that. We recognize we were a much smaller organization when Park Nicollet was able to do this. We also recognized at the time that we were doing it that we felt like we oftentimes had the discussion in circles, and nobody wanted to be the one to say, I'll sign off on this. And I think that continues to be the thing that's a challenge, is there's not that we're absolutely going to do this buy-in, but we're going to do the best that we can. Those retail locations made a big difference. Just as you look at a vending machine, that there are very few options. Continue to look at sales data and see that those sugar beverages are just not selling all that great. The juices do a little bit better, but the sugary sodas and sugary drinks really don't. So, 80% is the goal that we make for sure. We're oftentimes much higher than that. So into the 90s is what we're hitting.
Great, thank you both for, and I guess just a quick follow-up on the revenue piece. There was in the chat, and it sounds like you were starting to answer it, Susan, a little bit. So the question in the chat was about the effect on revenue for food service department and kind of managing expectations with the decrease in revenue, and what you observed kind of short and long term in terms of revenue. And so.
Yeah, in the short term, it definitely dips, but we very quickly recovered. In long term, we have continued to see those strong numbers that had been there previously. It was really very short-lived. And again, you look back at what was available 4 years ago, things weren't quite as exciting. I think that our vendors have done a great job of bringing in new products, and that gives people an opportunity to try something without having to buy the whole case of it in the store and discover you maybe don't care for it. So it's been great to work with those kinds of partnerships and see those opportunities open up.
Yeah, Jody, anything to add to that with what you all experienced in terms of?
I almost don't want to say it because I don't know that it's the norm, but we actually saw an increase in revenue in some of our vending, and I don't want people to expect that that's what happens. It did for us, and that was great. But if you're doing this within an organization or you're partnering with an organization, I think, Susan, you mentioned really being okay to say we might lose some revenue here, and making sure that everyone can understand that, and it's not on somebody's performance metric that, oh, you didn't meet your sales. So, and bringing in the vendors early and often was really helpful for us, so that we were, in sync as we were moving towards implementation.
Yeah, and sort of an extension of that comment, Jody, kind of engaging vendors, managing expectations and those types of things, and managing different interests. So 2 questions actually that came through in the Q&A relating to pushback. So the first around a question for you, Jody, about pushback with the sponsorship policy, and then the second one for both of you in terms of pushback from corporate entities, vendors, Big Soda, or other groups, and what did you experience and how did you handle it?
Well, in regards to the sponsorship policy, it is easier today to have those conversations because of the policy than it was prior to having it. Because there was, even within our own, we had a kind of governing board of, or steering committee for our childhood obesity prevention initiative. And when I came forward and said, McDonald's is willing to give us all the milk and apples we want for something or other, but it will have their logo placement on it and they want to partner with us. One of the physicians said, well, why wouldn't we take their money? We take money from Coburn's, who's our grocer, and they sell alcohol and tobacco. And I was like, wow, okay. But so then we went through and had deeper conversations. And, when I look at this policy guide, it has, what is the organization's impact on health and on children's health in particular? Does the organization have a reputation for contributing to the childhood obesity problem? Well, we could clearly there say, no, Coburn's has really been instrumental in trying to help us where they can. and we haven't gotten that so much over here. So once we had the policy in place, it became easier to have those conversations. And like I mentioned, during COVID, when one of our meatpacking plants had some significant outbreaks in their employees, and some of our trauma-informed care team came forward and said there's so much they could be doing better here for their employees. And it was really a struggle. So at the end, they wanted to gift us some money. And we just didn't feel that that was appropriate. So we referred back to this policy to say, here's what we feel. And it is a struggle specifically in these times, specifically in healthcare, where we're losing a lot of money because of the pandemic. It's easy to want to just say yes, but if you're constantly the one who's advocating and you know, banging that drum saying, we really need to stick to this, we really need to adhere to this, then it becomes a lot easier. And I'm really glad that we have it so that we have a backdrop to you know, reference.
Mm-hmm. Great, thank you for that. Susan?
Our experience with Big Soda was really disheartening. There were a number of us that weren't typically meeting with the soda companies and went to some meetings with our food service director, who had a long-term relationship with these people, and they brought forward data and information that just wasn't accurate. And so even as a nutrition professional, she wasn't aware of some of the research that was out there, and we could help to counter some of that. They came around, and you know, especially when we made it clear, now this is where we were going, and coming up with alternatives that could be served. But there was a great deal of concern at that point of losing that real estate, and we had to keep massaging the idea that no, you're not losing it, we're just shifting it to something else. And again, keeping the diet beverages was also an important part of that.
And I would say too, from a urban rural perspective, we're more rural Minnesota. The people who own our vending companies very often sit on our board of directors at one of our facilities. So there's a very tight relationship there that we want to make sure that we are being sensitive to. They do a lot in terms of philanthropy and giving to the organization. So that can both be really positive and make things challenging, but it's also just a reality of something that we have to keep in mind.
Thank you both. So you both kind of alluded to kind of how some of your sugary drink work fits in kind of a broader context, right? And I think Jody, you had mentioned the goals around healthy beverage product availability and what that looks like in conjunction with healthy food availability within your hospitals and facilities. And Susan, similar for you, kind of thinking about focusing on beverages versus focusing on food and beverages, and how your two organizations kind of saw the work to address sugary drinks or promote healthy beverages, and how that kind of fit into the broader work around food environment, either internally, externally, as well as kind of worksite wellness initiatives or food as medicine approaches. So yeah, kind of this point of where it fits and some of the opportunities and maybe things to think about in terms of focusing specifically on beverages versus focusing on beverages as a component of some of these broader initiatives.
Our organization does do biometric screening annually, obviously not this year, but typically, and then you need to meet certain criteria, and that depends on, you know, what your insurance coverage rate is going to be, and it's blood pressure, glucose, etc. So we use this as an opportunity to say we're supporting our employees in that journey to better health. When it came to food, a little bit different approach. We kind of just took some easy wins, and was it really necessary to have a bar like the size of your head, or could we maybe make smaller size bars? People could, you know, we're not taking everything away, but just making it more a little bit, you know, smaller. And then also food placement, kind of like we did with the healthy checkout lanes in the grocery store. When you're checking out at point of sale in one of our cafeterias, what's around there? And we started to put out fruit baskets and healthier for you granola bars and healthier options, so that if people were going to be, I'm going to grab something, they were more likely to grab something with a higher nutrition value.
Right, and that's similar to the work that we did as well, was moving things away. Fortunately, a remodel of the cafeteria came along not too long after that, so it made it a little bit easier that it got incorporated in there and everything was in a new spot. So we were able to do that too.
Yeah, remodels can be your friend for sure.
Yeah, yeah.
Definitely an opportunity.
Mm-hmm.
Yes, for sure. And actually, on the webinar, we had an example of that, of a hospital in New Jersey actually sort of taking advantage of a cafeteria closure during COVID and using that as an opportunity to kind of reopen with something new and different. And so, yeah, closures and remodels can certainly provide an opportunity. We have a couple minutes left, and in our closing time, I wonder if maybe we could circle back to, there's a lot of folks who are listening in who either work for a health system or a hospital, or maybe a food service vendor. And I'm curious, just in terms of back to this point of where to start, right? If this is an issue that an organization wants to take on, they want to do something about it, where would you recommend they start? And also maybe what are some of those key things they should be thinking about as they embark on this journey?
Susan, do you want to go? I'm just curious what you're going to say, see if it matches.
Sure. You can tell I'm not rock solid on this, but again, I go back to our Better Eating Collaborative. I mean, we were just amazed when we opened that up that we were going to do this at the broad number of people that came. And again, not necessarily people that were clinician minded, but just everybody were there to learn. And that's my background, is in education. And so that's our organization as well. That's what we use as an incentive. Like Jody mentioned, their incentive with the biometrics. We use education. If you've gone to a certain number of seminars, then you get the reduced rate on your insurance, and you get a small cash benefit. So start with that education. Taste testings were also really, really important. People like to eat, so get it out there. Let them see.
And I would say I agree with that completely. And I say if you really don't know where to start, it's unlike a lot of grassroots options where you start from the bottom up. I would say this time start from the top down. Our CEO was very, very supportive, as were many of our providers. We went to the president of our clinic and said, here's our case, and we really should be, we should be leading. And then we could also say, Alina does it, or Health Partners does it. We don't want to be first, but we don't want to be last. But then once we got administrative leadership to say we're doing it, that became a lot easier for us, because they were the ones who were kind of the wind behind us.
Yeah, thank you both, and I think those last points really summed up the focus of this session, really on thinking about how does an organization fit and relate to others in the community, other employers. What are the lessons that they can draw, and helpful peer pressure to draw on to help push forward change internally. And then certainly, again, thinking about and really underscoring the importance of engagement and early engagement, and having those opportunities to ensure people are heard, both during the development process as well as during the implementation process as well. And then, yes, certainly using those lessons also as ways to help others through policy engagement, or Susan, as you mentioned, through your health and well-being clients at the health plan. So, so I want to say thank you again, Jody and Susan, for your time and your thoughts and your stories. This has been really helpful and interesting. Thank you all for attending. As Stephanie mentioned, there will be a recording of this that goes up, and as well as links to the resources that were mentioned during this webinar. We'll get that up as soon as we can. So again, thank you all and have a good day.
Thank you.
Bye.